Hi there. My name is John Knight. I'm a physical therapist with Altius Physical Therapy and Wellness here in Eagle. We also have another location in Avon, Colorado as well. This is the second lecture of a four-part series titled Aging and Wellness. And for this, we are going to talk about balance and falls. Okay. So if you haven't already, feel free and please check out our functional resiliency lecture. That's the first of the four, and I think is a really good place to um, start off talking about these other topics as well. So go check that out when you have a chance to. But let's talk about balance and falls. Okay. Um, when we think of a fall, I don't necessarily think of this the way that the World Health Organization does. But they define it as a person coming to rest inadvertently on the ground or floor. Okay. Obviously, a fall is a lot more emotional and it's scary, and it's something that we want to prevent, right? Let's get into it. Okay. Um, Unsurprisingly, as we get older, our risk of falls increases. Okay, and more so, unfortunately, in females than it does in males. And I don't have a great reason for why. But by the time that we are around 80 to 85 years old, we're almost at a 50% risk of falling. So um, our goal, and hopefully after this presentation, I'll give you a couple strategies so that you are not one of these 50 percenters. Okay. So let's talk about the three different components to balance, right? Whenever I talk about balance, I like to break it down into these three different parts. The first is my eyes, and then my ears, and then my feet down on the floor, okay? My eyes relate to my visual system. So my eyes and my visual system tell me a lot about my environment, right? Am I walking on, or am I walking into a really busy, crowded area? Do I have plenty of space to move? Um, are there any objects that I need to walk over or step over? All that sort of stuff gives me a lot of information and helps with my balance system. And if you want to test this theory out, right, um, try standing with your eyes closed in a corner or something like that, and then try balancing with your eyes open afterwards. A lot harder to balance without your eyes, right? The other two components are our ears and our feet. So our ears relate to our vestibular system. So this system tells my body and my head where I am in space, right? Am I upright? Am I looking up? Am I looking down? Am I rotated? Am I moving? Stuff like that. Um, if you've ever had vertigo, I'm sure that you can speak to how important the vestibular system is in maintaining your balance, right? Um, but our ears really talk to our visual system a lot, right? Um, as much so as we even have a reflex that communicates between the two, and this is called our vestibular ocular reflex. Okay, go ahead and practice here with me. So I want you to put your finger out in front of your nose here and take a look at your finger and then move your head back and forth or up and down like that while keeping your eyes on the top of your finger. Okay. Notice how for some of you this might be hard or that finger might have gotten a little blurry. But for others, that you might have been able to really do a good job of keeping your eyes focused on your finger. That's your vestibular ocular reflex. And why this is so important is because it can maintain my gaze or my vision on an object regardless of how my head is moving. Okay, so think about this as like if I'm walking on an uneven surface or I'm walking on a trail or something like that, and I'm moving and my head's moving a lot, or ooh, a bird over there, right? Can I keep my gaze on the path ahead of me as my body's doing whatever motion as I'm walking, right? That's really important. If I can't do that, then that's going to make my balance that much harder. Okay. So that's something that we take a look at when we assess people's balances is their ability to communicate between their visual and their vestibular system at the same time. Okay. Your feet is the other component here that I like to talk about too. So our feet have a lot of different nerve endings on the bottom of them, up to 20,000 nerve endings. So those nerves are giving our body a lot of information about what the environment is that we're walking on, right? Am I walking on a flat, even surface, or am I walking on a slippery surface? or an uneven surface. My feet are constantly talking to my brain and telling me what environment I'm walking in, okay? They also, especially at my ankles, tell my body the position of my ankles. Every one of our joints has like a proprioceptive receptor in it, meaning like a nerve that tells my body what it's doing, what that joint is doing in space. Okay. So for my wrist here, right? These little nerves are telling my wrist, am I extending or am I flexing? Am I rotated? Whatever. And all of those nerves are in each of our joints. So specifically at the ankle, this becomes really important too. If you try to balance on one foot, you'll notice that your ankle is always shaking or it's adjusting and making small little compensations here or there. That's because those nerves are talking to your brain saying, ooh, we're really dorsiflex or we're really bent forward. We need to compensate and come back. Or ooh, we're leaning over to the right a little bit. Let's correct and shift back upright a little bit more. So our proprioceptive system is a system that tells our body what our joints are doing in space. And that's a really important component to our balance as well. So all three of these balance or these components work together to keep you upright and to maintain your balance. Okay. We can also then further break down our balance into 4 different types of balance, right? The first and the most common one is your static balance. So this is your ability to maintain your position or your balance while you're not moving. Okay, so think about like if I'm standing still at a crosswalk or something like that, or if I'm trying to balance on one foot and hold that posture for a long time, that takes muscle endurance and it takes strength. And then this also takes what we call an ankle and a hip strategy. And what I mean by that is just like I was talking about with the proprioception, right? If I'm balancing and my ankle's doing all these constant little adjustments, that's what we call ankle strategy. So the strategy for maintaining your balance is that your ankle is compensating and doing all these little micro adjustments, right? The other that we have is a hip strategy, and then we also have a stepping strategy too. So when I think about staying upright, I'm using either my ankles or my hips, or I'm taking a full step to maintain my balance. And that's what I mean by that. Okay. The next is your dynamic balance. So this is your balance as you're moving through space. Okay. Obviously, we're mobile creatures, right? And we need to be able to maintain our balances regardless of the environment that we're in. While we're moving at the same time. Okay. And this is where that vestibular ocular reflex comes into play. Okay. If I'm walking down a trail and I'm focused on a tree that I don't want to run into, right? As I'm bouncing up and down on the trail, my eyes need to be able to focus on that object in front of me so that I don't trip over it, right? And the other is dual task, okay? So dual task, like the name implies, is our ability to focus on 2 different things at the same time while we're balancing. Oftentimes when I ask people what happened when they fell, they tell me, oh, I was on the phone chatting with Nancy, or I was cooking food and I turned around and I tripped over my dog or something like that, right? But being able to maintain your balance while you're focused on something else at the same time or holding a conversation is really important at reducing your fall risk. Okay, so again, dynamic balance meaning as we're moving, can I maintain my balance? Okay. Anticipatory balance is related to planning for how you're going to move. Okay. Imagine I have to pick a really heavy box up from the ground. Okay. My anticipatory balance is going to look at this box and say, this is really heavy. I need to produce a lot of force in order to pick this box up and keep my balance. Okay. Compare that to if I thought that the balance was going to be really, or the box was going to be really heavy, and I go to pick it up and it's really light, and I produce all this force, I might fall back a little bit, right? Because I had poor anticipation of the balance demands of carrying that box, right? So anticipatory balance is something also that we take a look at too. And then the big one that we often don't train as much as we should is reactive balance. Okay, so this is your ability to catch yourself before you go down. Okay, think about like if I'm walking in my house and my toe catches on a rug or something like that. Do I have the reaction to put my foot out quickly and prevent myself from going down? And this is something that we train a lot in physical therapy. where we actually practice falling forward or backwards or to the side and work on getting that leg out really quick to catch us, okay? When I do stuff like this, things that I'm looking for to see are, when you lose your balance forward, do you take a bunch of little steps before you catch yourself, or are you able to do one large step to catch your balance? So that's something that that reaction time is something that we can work on and train as well. Okay, and this also speaks to why leg strength is so important, right? I need to have the strength in my legs to hold my body upright if I do lose my balance. Okay, quick activity time. This is a really quick, not comprehensive, but a quick assessment and way to see if you are at a risk of falling, okay? So what we'll oftentimes do is something called the 30-second sit to stand. This is a test that measures how many times can you stand up and down from a chair in 30 seconds. Okay, so go ahead and try this. So maybe pause this video and do this really quick. Set your watch for 30 seconds and count how many times you can get up and down from your chair. And then when you're done, come on back, okay? Okay, so hopefully you had a chance to do that. Once you've gotten your number of how many times you can stand up and down from your chair in 30 seconds, take a look at the chart here, right? If I'm an 80-year-old, okay, and I'm a male, I would expect to get at least 13 sit to stands, so 13 up and downs. If I can't get at least 13, I am at a risk of falling, okay? And again, this isn't a comprehensive test, but it's just a really quick way to measure if you are at a fall risk, okay? So take a look at the chart and correlate it based on your sex and then also your age as well, and you can get a quick idea, okay? Let's talk about some of the consequences of falling. So this can kind of be a scary topic here, right? We can break it down into physical and psychological. The first for physical being a risk of fracture. And this is where, this is why we really focus a lot on fall prevention so that you don't have a risk of fracture. And this is also why we build up bone strength and resiliency. But we know the two most common places to get a fracture after a fall is your hip and then also your wrists, okay? And so what we oftentimes see is that if somebody has a fall and they land on their hip, sometimes we can fracture the femoral neck, and then that would be a case when you'd have to go to the hospital. But hip fractures increase our mortality rate, so our risk of death. And this is why we take this so seriously and why we focus so much on prevention instead of rehab here. Okay. The other risks we have too are concussion, right? If I fall forward and hit my head on the way down, or the back of my head if I fall backwards, right? Skin lacerations, if you're a bleeder, too, this can become a problem. So just laceration, meaning like a cut on your skin, right? Rhabdomyolysis is a fancy word. This relates to if you have a fall and you can't get up from the floor and you're stuck on the floor for a long time, this will actually cause muscle breakdown, and then this can harm your kidneys as well. So again, another scary thing that we want to avoid. The physical risks of falling too are usually we see lower levels of activity in people that are at a higher risk of falling, right? If I'm worried about falling all the time, I'm probably not going to want to go leave my house and go on a adventure out on the town, right? I'm going to want to stay in a safe environment. So we want to improve your confidence and your balance so that you're not just homebound all the time, okay? And then the other one too, money is really important, right? So the average cost of a fall, when you take into consideration going to a hospital, all the other healthcare costs, back in 2015 was almost $10,000, right? Now in 2024, with inflation, that's going to be even higher. And so if we can not only reduce your risk of falling, but also save you some money too, okay? Psychologically, and this is a big one, this is why I highlighted this in red, is the fear of falling. I'll talk about this a little bit in a second, but if I'm constantly worried about falling, this is going to change the way that I move and the way that I see the world. And so this can be a really big problem that we need to address. If you're always worried about falling, we need to improve your confidence. Okay. And related to that too is social isolation, right? If I'm always worried about falling and I become less active and engaged in the community, social isolation can quickly become a downward spiral, right? Same with depression and anxiety, and then also a dependency on family and friends and the healthcare system as well. So ultimately, we want to keep you independent, right, and allow you to live the life that you want to as long as you can. So um, let's talk about a little bit happier slide here, okay? um, we can break down all these factors to falls into modifiable and non-modifiable factors, right? Non-modifiable meaning things that I can't change as a therapist and a trainer, right? I can't change your age, I can't change your gender, and I also can't change your history of falls if you've had falls in the past. But look at how many more things that we can improve on than things that we can't change, right? Like I just talked about, fear of falling. Um, Fear of falling is really important, okay? And this is why. If I'm constantly worried about falling, I'm going to do a couple different things. One, I'm probably not going to move around or be as active as I used to be. The other two is that I'm going to change the way I look at things. So if I feel unsteady or balanced or unbalanced when I'm walking in an environment, I'm probably going to pick like an object on the ground or something like that to focus on to improve my balance. But this can become a problem, right? If I'm in the grocery store and I'm walking and I don't feel steady, I might pick a point on the floor off in the distance to focus on to steady myself. And in doing so, I might miss the cart that's coming at me or the object that I need to avoid, right? So that changes the way that we look at the environment that we're moving in. The third problem with having a high fear of falling is that it changes the way that we move. If I constantly feel unsteady or unbalanced, I'm going to take really short little steps as opposed to a long gait or a stride. Okay, and I might not lift my feet up off of the ground um, because I want to keep contact with the ground and improve my balance all the time. And so if I don't do that, right, then the likelihood that I'm going to catch my toe on something becomes even higher, right? So this changes the way that we move in our environment. So firstly, addressing the fear of falling is a really important thing that we as physical therapists take a look at. Okay. Leg strength, I kind of talked about, but this is really important too, right? If I have really strong legs and I feel confident using them, then I can react quickly and catch my whole body weight. Additionally, if my ankles are really strong too, those can use that ankle strategy that I talked about earlier to help keep me upright. Okay. Balance, obviously, we can improve on any of those three factors, the vision, vestibular, and then our feet. If we have a deficit or a problem in any of those factors, those are things that we can address as well. Orthostatic hypotension relates to our blood pressure. Okay, so if you've ever been on a long car ride or you're sitting for a long time, say watching the Super Bowl, and you get up and you feel really lightheaded, that's because all the blood is down in your legs and not up in your brain. And so then that can create dizziness, right? And so then that becomes a blood pressure thing that you should talk with your doctor about, okay? Or do one strategy I use, just a little tidbit. If you're sitting for a really long time and you're going to stand up, do a couple ankle pumps, okay? Or just kind of lift your heels up a couple times. That helps to promote the return of blood back up to your head to reduce the orthostatic hypotension. Incontinence is a really big one too, and this refers to our ability to hold and control our bladder. So if I have a hard time doing that and I really have to go, and I know it's coming quickly, I might rush to the bathroom, and that rush means that that's going to increase my risk of falling too, right? I might trip over something on the ground. I might be walking too fast and catch my foot, whatever. But working on pelvic floor strength and improving your continence and your ability to control your bladder is a good way to reduce your fall risk as well. Gait speed is an interesting one too. If you walk on average slower than 1.3 miles an hour, then or conversely, if you walk faster than 3 miles an hour, Those two, being higher or lower, too fast or too slow, can increase your risk of falling. So kind of right in the middle, and walking at a comfortable gait speed is important too. Okay. Chronic pain is another one too. If you're always in pain, say your hip's been bothering you for like 5 or 6 years or longer than that, that's going to change the way you move. That might decrease your leg strength as well and increase your fall risk. Okay. Home environment is a big one. We're going to delve into that one in a couple slides here. Multiple prescriptions is really important too. The reason this is so important, this is what we call polypharmacy. So if you're one of those people that wakes up in the morning and you have a pill box and you've got like 20 pills in there, and you have to take all those every single morning, I'm not advocating that you stop, but what we found is that multiple pills and taking a lot of medications at the same time can increase our risk of falling too. Oftentimes related to if they affect our blood pressure, like I was just talking about, or if they have any sort of interaction between the drugs. That can cause dizziness and stuff like that, which can increase our fall risk and reduce our balance. Okay. Visual impairments. That's not something that, well, some physical therapists work a lot on vision, but that is something that we can modify as well. And then also cognitive decline and attention. Making sure that you're very attentive to your balance in your environment is something that we can train as well. Okay, so a lot more modifiable factors to improve our balance on compared to things that we can't change, right? This is a happy slide. Okay, so let's talk about some actionable items here, right? The first thing that we can do to improve our balance is work on our gait speed, okay, our walking pattern, improve our ankle strength and the strength in our legs, right? If my legs are strong, I'll feel confident walking and I'll feel confident holding myself upright with my legs, okay? Our balance systems, like I just talked about, those 3 different systems, if you have any sort of deficits or impairments in any of those 3, then those are things that we can address as well, okay? This is a fun one, learn how to fall. We're gonna talk about this a little bit more in depth in the next slide here. But just improving your confidence if you have a fall can reduce your risk of fracture and reduce your risk of falling in the first place, okay? But we'll talk about that again in a second. And then improving your confidence, right? This is what I was talking about with if you are unconfident with your balance, this is going to change how you look at the environment, how you move through the environment, and also your activity levels, okay? If I also feel confident in my balance, this will reduce my visual dependency. So I might feel more comfortable maintaining my balance with my eyes closed. Okay. Just having a positive stereotype about your age, though, is really important. So thinking positively about your age and the aging process can increase your likelihood of recovery, say you have a fall, by up to 44%. Okay, so again, just thinking positively about it and having positive experiences is a really powerful tool that we have in our toolbox. Okay, and this is something that it doesn't happen overnight, right? But if we can train your confidence with your balance system, we can improve your age-related stereotype, right? Let's talk about how to actually fall. And when I gave this lecture in person, we actually practiced some of this, and it's kind of weird, but it's really fun at the same time. So we'll go each of these one by one. The first is don't freeze, right? If I trip on something, oftentimes we have this propensity to just freeze and get really stiff, right? We want to like guard our body from the fall, but that's the last thing I want you to do, right? I want you to be fluid so that you can react to the fall and have a better reaction as opposed to just getting really stiff. Okay. The next is getting low. I'm 6'6", so I'm a pretty tall guy. And the saying that tall trees fall hard is pretty true here, right? If I'm really tall and upright and I go down, that's a lot further distance for me to fall, as opposed to if I know I'm already going down, if I can get really low and close to the ground, that will reduce the forces on my body when I hit the ground. Okay. Avoid straight lines. Okay. So this means like straight arms and legs. think about a snowboarder, right? If a snowboarder is going to fall backwards, what's the first thing that they usually do, right? They they extend their arms back like that, and then instead of the muscles taking the result of the fall, our bones take it. And so this is why we see so many wrist fractures when it comes to falls as well, is because we put our hands out like that and we land right there on the wrist and we get a scaphoid fracture or a wrist fracture here. Okay, so instead of having really straight arms and legs, again, get low and try to get into a tuck and a low position before you go down. Okay, spread the impact across your body. So for this one, if you ever think about a gymnast here, right? If you've watched the Olympics and you see a gymnast fall or tumble, they do a little roll, right? They carry their momentum with them as opposed to just coming to a quick halt. So if you are going to fall, if we can teach you how to roll and use your momentum as opposed to just coming to an abrupt halt, that will decrease the amount of forces going through your skeletal system, right? Number 5 is land on the meat, okay? So imagine that I am falling backwards, okay? Right away, first thing I don't want to do is straighten my arm out like that and try to catch myself on my wrists, okay? What I want to do instead is get low, curl up, and try to land on my butt, right where all that meat is down there, okay? One of the most common areas that we see for a fracture after a fall is the hip, specifically at the femoral neck in your hip, okay? And this is because we land on the side, right where that bony bump is on the side of your hip. That's part of your femur. And if we land on that, all of the forces of the fall are going through that bone and can reduce or increase our risk of falling. If instead I can land on my meat and on the muscle, that will absorb the force of the fall a little better, okay? The last 2, protect your head. If I'm falling forward, what I'll practice with clients, excuse me, is turning my head so that I'm not landing on my forehead and increasing my risk of a concussion, right? Instead, if I turn my head here, I might land more so on my cheek instead, okay? The other, if I'm falling backwards, is that I want to tuck my chin here. And if you've ever done gymnastics, this is one of the first things that they teach you to do, right? Tuck your chin like this so that when you're falling backwards, instead of smacking my head back here, my upper back can take the force instead. So again, reducing the likelihood of a concussion, okay? And then we practice, right? There's a lot of stuff here to think about in the split second that you lose your balance before you go down, right? And the most common question I get when I talk about fall prevention is, how the heck am I supposed to remember and think about all these things in that split second? And that's not my goal. My goal is for you to have practiced so many times that this is just muscle memory, right? If I'm going forward, not putting my hands out, I might land on my forearms instead, and I'm going to turn and tuck my head, and I'm going to do a roll. Either way, I want it to be more muscle memory so that you don't have to think about it in that split second. But that takes a lot of training and repetitions over and over again and practice so that when the time actually comes, you feel confident in your ability to fall. And also you don't have to think about all these 20 different things while you're going down, okay? So then this is a good discussion that you should, or a good question you should ask yourself too, right? Can I get up from the ground? If I have a fall, I don't want to be stuck on the ground for hours. I had a rotation in a hospital, and I can't tell you how many times I heard the story of an individual having a fall and being stuck in their home on the ground for a day, even up to 5 days is the scariest one that I heard. Okay, so being able to get up and down from the ground is really important. And there's 2 different methods that I like to train. The first is the lunge. Okay, so take a look at this picture here, right? This woman's doing a lunge with a kettlebell here. Okay, imagine if I'm on the ground, what I would do, right, is I'm going to get onto my hands and my knees, okay, and then I'm going to put one leg in front of the other, move it up there, and now effectively I'm in this lunge position here, okay? So that requires a lot of strength, right? Can this leg, her right leg, lift her entire body weight all the way up to an upright position? So this is, again, why leg strength is so important for fall prevention. This is something that takes practice and isn't something that I advise you just go try to do a reverse lunge if you haven't done this in the first place. Okay, but this is one strategy that we can use to get up and down from the ground. And this is important to practice without using your hands too, because sometimes we're lucky we have a fall and then there's a couch next to us or a chair or something like that to push up from, but it becomes dangerous and scary when we don't have something to hold on to when we're getting up from the ground. So I advise everybody to be able to get up and down from the ground without having to use their hands to push off of as well. Okay. The other option is a downward dog. So this picture right here, think of like a baby, right? Babies fall like 20 times a day. I think it's actually even 17 times an hour or something crazy like that. They kind of get up in this weird position here where they're on their feet and their hands and they slowly walk themselves back to an upright position, kind of like a downward dog here. If this person were to slowly walk her hands back towards her feet and then stand up. I use this strategy for if somebody has a lot of knee pain and they can't tolerate kneeling on the ground, we can practice this. The downside though is it requires a lot of hamstring flexibility, so the muscles in the back of your leg, because you need to be able to touch the floor effectively, and you need to be able to get yourself back upright from a really forward bent position. Okay, but these are two of the most common ways that I practice getting up from the ground. Okay, let's talk about reducing our risk of falling in the first place through exercise. Okay, just being active and doing general exercise is a really powerful way to do so, right? So just general exercise, so you go to the gym or you have a group of friends that you like to walk with or go snowshoe with, that can reduce your risk of falling by 24%. Okay, if I combine a variety of different types of exercise, but just generally, okay, that can reduce it even more, right? If I'm doing a strength program and I'm doing a little bit of balance and I'm doing an aerobics program, and say maybe I swim or something like that, all of those together reduces our risk of falling even more. Okay, Tai Chi is a really good one to reduce your fall risk too. I like this because it works on that static and slow movement, also our dynamic balance. But the big thing too that I like about Tai Chi is it teaches our ability to understand where our body is in space, right? Going back to proprioception that we talked about in the earlier slides. Tai Chi is a cool way to understand how each of those joints are moving together and develop a better body awareness. Okay, so that can reduce your risk of falling by 23%. Doing really targeted balance as well as strength and resistance training each week, though, if you did so on more than 3 hours a week, so say you did an hour for 3 days each week, you can reduce your risk of falling by 42%. Okay, so this is strength and resistance training, right? This is lifting heavy stuff up off from the ground, right? Squats, deadlifts, stuff like that. In our Thrive Forward class, we practice deadlifts and squats and lunges with every single person because we know this has such a really positive impact on reducing their fall risk. Okay. Chair yoga, on the other hand, is not enough. Okay. So there's the answer to that question, right? Chair yoga is not enough because we're sitting down, right? This isn't challenging our balance system or our vestibular system. Chair yoga might be really great for improving your arm strength, just getting some motion. If you are an individual with chronic pain, this might be a good option for you to just get some movement. But to actually challenge our balance system, we need to be upright and we need to make it hard, right? People, when I train them their balance, it's a different kind of challenge because it can be really frustrating, but we have to challenge the balance system enough to actually create a significant change. Okay, so again, chair yoga is not enough. Okay, let's talk about the home environment. Okay, this is the easiest way that you can reduce your risk of falling at home. Okay, take a look at this picture here. We've got some loose carpets over here. I might trip on the corner of this rug here. She's got a bunch of cords everywhere, easy tripping hazard. We've got boxes on the stairs. You might not see one of these boxes when you're going down. Next thing you know, you trip over it and you're going down the stairs. The rug might slip out from under you. So I advise people to Get rid of loose rugging or loose carpets and stuff on the ground. For your mental health too, just reduce some clutter here. The other things that I see too, we've got a variety of different pills here. That's talking to that polypharmacy, right? If I'm taking a lot of different prescriptions at the same time, this can increase my risk of falling. Although these ones have some cobwebs on them, so maybe our friend over here needs to actually keep up with her medication. And then the coffee's boiling, right? This creates a sense of urgency, and we'll talk about that and why that's so important in just a second. We're almost done here. This is the urgency component, right? As we age, right, we oftentimes in the middle of the night have to go, and we have to go quick, right? So making sure that there's a path that's clearly visible and doesn't have any tripping hazards in the way is really important. Because when you wake up in the middle of the night and you realize I have to go to the bathroom, you might have a minute, if you're lucky, to get there, right? So doing things like having a walking device ready to go. If you use a walker, make sure that thing is already open and it's sitting on the side of your bed, as opposed to having to fumble with the walker before you get out of your bed, okay? If you do have a problem with incontinence, it's not a bad idea to consider wearing an adult diaper, right? Instead of having to get up from your bed and then go to the bathroom, having an adult diaper will reduce some of the urgency having to get to your bathroom, okay? And then again, good floor lighting. So if you're using a night light, or you keep your bathroom light on or your hallway light on in the middle of the night, that just makes it so much easier so that you can see where you're going, okay? Okay, so this is the bottom line, right? This was a study where they took 42 older adults, okay, so above the age of 65, and they split them into two categories. One half of the group had like an educational series where once a week, somebody gave them information about fall risks and balance, okay? That's this one up here, okay? The other group, the ABLE group, these guys got an one-on-one in-person balance intervention training, okay? And so what the graph shows on the left, we have falls efficacy score. So a higher score means a higher risk of falling. A lower score means a lower risk of falling. The group that just got education, over time, the education actually reduced their risk of falling because they became more confident in their balance, right? Just learning about it, okay? So that's what we're doing here, right? We're already making a change. But the other group that worked with the therapist one-on-one had a significantly lower risk of falling, okay? So over the course of the 8 weeks that they worked with the trainer, their risk of falling went from like 41 on average all the way down to 30. So like a 25% decrease in just 8 weeks. And then they stopped the intervention, and then they took a look at their risk of falling afterwards, okay? So this is when they stopped right there. Notice how this line goes back up, right? The risk of falling started to increase despite having seen a trainer and worked with them for 8 weeks. So what this speaks to is the fact that we need to stay consistent and keep working on our balance. It's just like if you were to go to the gym, right, and you were to work out all the time, yeah, you're going to get stronger, but the second that you stop doing that, right, we're going to lose some of that strength. Same thing with the balance, right? This is something that we have to keep up with throughout our life and keep working on the balance, okay? Generally speaking, if you are just active and you do general exercise, again, this can reduce your risk of falling by 23%, but it's way more effective if we can be specific to your needs, right? Taking a look at those 3 different components of balance and addressing any other medical or home issues that we might need to, but being really specific to your needs is much more powerful than just doing general exercise, okay? The cool thing though is that doing exercise, especially heavy resistance training and strength training, not only can it reduce your fall risk, but also reduce your risk of fracture by over 27%, okay? So that's another really powerful tool, okay? If you wanna just work on your balance at home, here's a couple things that I recommend, right? Remove your tripping hazards, improve your home lighting, develop a fall plan. This is an important one, okay? If you live alone, and you know that your balance isn't great, honestly, having one of those beepers that you wear on your neck, so that if you go down, you can't get back up, that you can press really quickly, is a good way to make sure that somebody's close or nearby, or that you have a plan. Or just having a friend that checks in on you every couple hours, okay? See a professional, right? If you have balance problems, or you know that you're at a risk of falling, or you've had a lot of falls this year, go see a professional. It's much better that you address it earlier than later, okay? And then the last thing, you can just practice some of these things at home, right? Our friend over here is practicing in a corner, and he's got a chair in front of him. Okay, so if you are going to practice balance at home, please do so in a safe environment like this, right? If he falls to the right or the left, he has the wall here to catch him, and if he goes forward, he has the chair that he can lean on. Okay, so the way that I would progress this is try balancing with one foot in front of the other if you can. Okay, if you can do that, close your eyes and try to do it. Again, if you can do that, then try doing it on one leg, and if you can hold that position with your eyes open, then try it with your eyes closed. Okay, so just a really quick and easy balanced task that you do at home. Okay, so thank you so much for listening. Here are all the references, and please go check out the next couple of videos here as well. All right, take care.